that deliver quality and reliability every time? Look no further. The Lagos Diocesan Printing Press is here to serve you. At the Lagos Diocesan Printing Press, we specialize in bringing your ideas to life with precision and excellence. Whether you need business cards, brochures, flyers, or banners, we've got you covered. And out from the crowd. But that's not budget. So why wait? Visit in impression. You can also give us a call 82570.
I am the Right Reverend If your number one. God bless you as you keep on listening upon you. Keep on listening. Jesus' name.
This is Lagoon Radio.
Good afternoon from this part of Lagos State. Welcome. And today, insurance cover me just with this khaki. So I'm not scared. So yeah, today we'll be discussing self-medication and how it leads to drug misuse and drug. I think after the program, I'll give my own information. So if you want to reach me on my social media platform or through WhatsApp, I will drop the info in Nigeria to self-medicate. Naturally, there's nothing wrong with self-medication, especially when it has to do with little ailments. I use the word little because there are some ailments that you can easily take care with one or two drugs. However, if not properly managed, and many a times people give you reasons while they do self-medication. We are going to discuss all that today. And in case you know somebody that is doing that and you feel that the person needs help, that what can I do? Yes, there are a lot you can do. So we'll discuss all that today. You are using available medication. What I mean, you can have headache, that's a symptom, or you can have stomach upset, or let me use the word diarrhea. That's also a symptom. So when you have headache, every do the other medications, but the first thing that comes to mind is that let me just take. In fact, some people even tell you the dosage. They are used to it, so they will tell you that they just take paracetamol. So that's an example of. We already know that because we are used to that it's over-the-counter medication. Our supermarkets, they sell some of these medications, just supermarkets. So it has its own advantage and is a normal practice. It's not something that is wrong in quotes. It's not wrong in quotes. It's just that the way some people go about it, that's where the problem comes from. Reduces the overall burden on the healthcare system. What I mean by that is that you cannot just be going to general hospital because you have a headache, paracetamol, and you'll be fine. Or you now call in my hand. The family will be looking at you that just smoke or just get methylated spirit now and clean and dress. Just get plaster and cover it. So our medical practitioner. Why everybody don't jackpot finish that way? So we don't want people to stress these health practitioners more. So that is why sometimes they talk about self-medication, but there are risk factors attached to it. So this is where the danger now comes. Some people try to self-medicate that advertise some of these medications like paracetamol. They usually make a statement after the advert. They will say, if symptoms persist after 2 days, please consult a physician. That is when Nigerians now have problem. Before they consult physician, they would have used everything in the world. Those are the dangers we want to discuss today. They will use everything. After using paracetamol don't work. They will now ask their neighbor, that because ibuprofen is an NSAID, it has its own risks too. Say, not be ibuprofen, no. Now malaria they do you. We are always trying to always claim that every symptom in Nigeria now is malaria. Especially this period, if you have catarrh, if you have a headache, it's malaria. If you have cough, it's malaria. If your leg is even paining you, it's malaria. So they will tell you, get anti-malaria, get this one, get that one, you'll be fine. Whereas just using medications like that can actually make your situation worse. So, and when we ask people, they give us different reasons why they self-medicate. We will discuss that before we go to the risks. First, they will tell you that the cost of medical attention or medical care in Nigeria is very expensive. It is. But at the same time, there are some that are not really expensive. You don't know it is even expensive. You have to get to the doctor. Some people even say, are you thinking that you take Agbo for malaria because it's cheaper? So they will tell you just a cup of Agbo is just 100 naira. Why would I now go and buy medication or go and see a doctor where you first pay 5,000 for consult? People give that reason. Also, they will tell you that I don't have time to be going to the hospital. Thank God we have some HMOs now and even some online pharmacies that makes these things easy for you, that makes diagnosis easy. You might just stay on your bed and consult a doctor. You know, you don't need to be your phone. If you are under an HMO plan, you can talk to your HMO, or you can just go online and look for an online pharmacy, and you let them know that you want to talk to a doctor, you want to talk to a pharmacist, you want to talk to a nurse. They will get you one. You just talk to them. I think for a token, you pay for a token, then they prescribe medications for you. Even if you don't want to go and pick up the medication, they will use dispatch. So the excuse of your phone. So because people usually give that reason, I don't have time to be going to the hospital, I don't have time to be sitting down. I understand sometimes you might need to wait a very long time in the hospital. So people tend to this fear of perceived stigma. You know, they feel that I don't want people to know that I have this. No. You don't have to do that. We're talking about your health here. You don't have to do that. At least take care of yourself. Even they're going to give you that stigma that he's always coming here, he's always sick. At least go to the hospital and ensure that you are properly taken care of. People usually use that as an excuse. Then hiding or denying a condition. The popular one is infection. People don't like it to be known that they have infection. So they tend to, I should give it a Yoruba name. Now, the way they use it is Dugbolishe. Ampiclos work for everything. In fact, they use Ampiclos. They use Ampiclos as contraceptive. They use Ampiclos as something to take care of infection. You know, I don't know who taught them that. You know, some in fact they even use it to take care of serious injuries. You know, in fact, it's like Bugbolishe, like I mentioned, but it's actually not the right thing to do. People use that as an excuse. They don't want people to know that not the fear of not wanting to take. I don't know what will happen to me if I should take that anti-malaria, because if I should take anti-malaria, I'm always sleeping. I don't want to go to the hospital. Let me just take the medicine that I can buy and use. Yes, it's normal to outside the effect, but you can go. Anytime you are giving me these antibiotics, they will make alternative for you. Another excuse we get from people is that the one they gave me in the past, it did not work. So there's no point of going back to the hospital. You have every reason. In fact, if they say me person even they go sleep for hospital, it should be you. Because if you start having this, or you have been using that drug before, as maybe in form of self-medication, now your body is used to it, it's not working. In fact, it's you that's supposed to be sleeping in the hospital. Go back to the hospital. The medicine you gave me, it didn't work. I'm back. What do we do? It's not left for you to just not decide that I'm not going back. Actually need to be retreated twice. 9 medications for ailments. We call them first line. We have second line. We have third line. So if you use the first line and it didn't work fine, that is not the. So they have to go further to second line. So people use that excuse. The last one I used, it did not work. Why should I go back to the hospital? Then it might not make sense to you, these excuses that some people give. It might not really make sense to you, but you have to view it from their own side of it. Like some of the things I mentioned here, if you are actually professional, or you as a friend, and you have somebody giving these excuses, you don't just judge them. You know, try to know why they decide not to go back, or they want to self-medicate, and see if you can be of help to them. And there are actually some ailments or some conditions to disconnect themselves, want to now start self-medicating. They just want to take care of themselves by themselves. And people that have bipolar disorder, you know, it's not usually very easy expressing yourself that I have this bipolar. Bipolar is actually a form of psychiatric issue. So before some people open their mouth and tell you that, I mentioned one of the reasons. So it might be a reason, or one of the ways people can actually go into self-medication. Then anxiety situation, then they want to take something that will calm them down. They want to take whatever they can say around to just make them feel good, make them feel relaxed. Then there's ADHD, that's attention deficit and hyperactive disorder. We see, or we notice that a lot of them have a lot of ADHD patient falls into that category. And the last one here is trauma from maybe outbreak. Maybe they serve the person breakfast, or maybe the person lost a contract, or it might even be a form of accident. Maybe there's a traumatic accident and the person just needs to take some things to get out of it. So they start taking painkillers, taking stimulants just to get out of that trauma. So these things that I mentioned, just a few, can actually lead people into self-medication. And we have different types of self-medication. Because when I've been talking about self-medication, people think that only drugs that self-medicate. Some people self-medicate on food. There was a day I saw a statement. They said if you are unhappy, eat. I don't know. Or if you are bored, you should eat. It's actually self-medication, because even food on their own, they are like drugs. They have nutrients. They have vitamins. They have minerals. So you're taking a lot of this stuff. Even some of these foods will have side effects. For example, now if you take 10 wraps of a bar, you might be drowsy. You might be feeling sleepy, or if it's a situation where you might just be doing yourself, that's part of the things that people can self-medicate, apart from drugs like stimulants, like painkillers, even alcohol. That alcohol is actually a depressant. People are just looking at me. I know that when you take alcohol, you forget your problem. Okay, my question now is, if you take alcohol and you sleep, when you or anything, it shouldn't even get in you the liver or the kidney. So let me just say that, by the way. And stimulants, marijuana, what they call this thing, they call loud, they call Canadian loud, whatever. So these things can actually cause problem, because if people take musical break. And it's a very nice song. A song I like dancing to. It's by, again, you will say again, Mercy Chinwo. It's by Mercy Chinwo. I like listening to her songs, and this song is actually a good song. It's a song that shows us why we song is from the rising of the sun, and it was written and composed by Mr. Chinwo. And when we're back, we'll further go deeper into this talk about self-medication, the risks of self-medication, and how to get help for people that
This your Obonge show, Duncan Diocese of Lagos. Join me here. We go they talk about it. Now for every matter we go that one now for Facebook at Lagoon TV.
Go Mount Zion go free and him go, but all the plenty yama wahala where they do you if you ever way we won't start. Then they call him down, see some breaking of fetters, and we know say Baba God go help person where need help. He go come out yama for plenty people body, and him go make all of una life better. Now every third Tuesday this one go they happen no, but also Church Lekki where they for number 15 Kayode Animation Street, where they for Admiralty Wayside for inside Lekki phase 1. He go start for 11 o'clock for morning time. Anybody wake call Baba God name, now him go see help and things go dey okay for am. Oya run come collect brekete blessing and miracle o. Na Right Reverend Ifed Olasenasu Gabriel Okupevi, the oga patapata for Lagos Diocese Anglican Communion, na he carry this story come.
This is Lagoon Radio.
People will be discussing why do people self-medicate, the reason why forms of self-medicate. Other parts that I've mentioned are important, but this is more the most critical, the most important, because these are the issues that people face. Self-diagnosis. What I mean by that is that you cannot say that what you have said is your issue is actually your issue. Okay, having headache. For example, having headache, having cold does not mean that you have malaria. So you might now be taking anti-malaria just because you have headache and fever, whereas it might be something worse that is happening. You fail in that your diagnosis, and that is when people start saying that the drug is not working, because you might be using paracetamol thinking that you have headache, and the headache is actually coming from high blood pressure. So you see, there's an issue of drug. So you are using the wrong drug for should I say, for the right ailment, the wrong drug for the right ailment, that is drug misuse. You are not using the drug the way. Even some people will not even use it and be fine. That one is medication. There's usually an incorrect diagnosis when it comes to that. Then there will be a delay in seeking appropriate medical advice. Okay, this is the reason, because you have taken a medication. I'll still use blood pressure as an example. You're having symptoms of blood pressure, and one of them is headache, and you're having this persistent headache. Then you took paracetamol, and you kind of feel a bit relief rising. So you will now decide not to feed on spoil pass the way you reason. No. So, and also there's potential adverse reaction. There are some people that don't take sulfur drugs just because they have some form of reaction to it. But because you are self-medicating, somebody will just tell you, take examples are ibuprofen, diclofenac, pyroxicam, popularly known as Felvin. That's the brand of pyroxicam. People take this medication to take care of pain. You know, so some people don't know these things, and some of these drugs can even be fatal. It can be devastating. It just take their life. So you don't just do that because of one of these factor here. Then worsening of the condition. Let me give an instance. For example, we have issue of cholera now in Nigeria, and you might be saying that the symptom looks like you just have a normal diarrhea. Then you just want to take a flagyl. I know that's what we like using in Nigeria, flagyl and red and yellow, tetracycline. You want to take that, and you are not sure what the major problem is. It might actually be cholera or something like gastroenteritis, and you think that, okay, flagyl will take care of it. While taking flagyl and you're waiting, you start losing more electrolytes, and can actually result to the loss of life, the individual. Then there are issues of dangerous drug interactions. You might be taking two drugs that you don't know they don't go together. There are many of those kind of stuff. You don't know that these drugs don't go together, and you take it maybe based on prescription from a friend or from a family. So dangerous for your health. Then another risk is that it marks severe diseases. This one is a sad one. I actually didn't want to use this example, but I think I have to use it for other people to be able to know. I lost my maternal grandmother June 4th, 2013, and she had stroke. She had stroke, but on trying to look for the cause or trying to check for the investigation, I was told painkillers. She has been having these persistent people that can take care of her. But some we believe we can handle things ourselves. Stroke. The stroke lasted for about 6 months before she eventually gave her to go. So you see, these things can actually can cause, and you'll be feeling relief from those symptoms. The last one here is the risk of dependence, like the cocaines, the stimulants, and the likes. Even some people are now abusing cough syrups in Nigeria, especially those ones that have codeine. It's not a drug addict. But I saw him opening a bottle of cough syrup and just drinking. I was like, but guy, this is wrong. Like, if I don't use it like that, it won't work. At that point now, that one has gone into drug abuse. That is serious drug abuse. Now, if he doesn't take a full bottle of expectorant, it won't work for him. The 10 meals 3 times a day now doesn't work for him again. Just because he has been self-medicating, he's now used to taking a full cup. And if not careful, he might become an addict. Okay? It's not everybody that self-medicates becomes an addict. I want us to balance. It's not everybody that self-medicates because I'm addict. But if it persists, it can actually push that person into that level of addiction. Drug dependence is not something easy because some of them have these withdrawal symptoms. What are withdrawal symptoms? Withdrawal symptoms are those symptoms you feel while trying to get out of a kind of addiction every day, and is not trying to reduce it, trying to stop it. If you decide to just stop immediately, you might be having some kind of symptoms like shaking of the hands and legs, not feeling so comfortable, agitation, and all that. So the person now, I'm already. How do we go? I want to encourage you, if you know anybody that's into self-medication, or the self-medication have pushed into drug abuse, or it has pushed them into drug dependence, a therapist, you can get a pharmacist, you can get a nurse. You just get a professional that knows about medication. And immediately you are getting a professional, be honest, be vulnerable, be open. Let them know I'm into drug addiction. I'm not the lot of painkillers. Even the very controlled one, like Tramadol, they take it to give themselves strength that if they don't use it, they will not be fine. And most times when you now see them where they are not working, you see the way they complain of pain because now their body is used to that kind of stuff. So you just have to be honest, lie to your pastor, and you don't lie to your lawyer and go to jail. Then if you lie to your pastor, there's no points lying. Then headache that you have, because if you have stomach pain, we'll give you something for stomach. And the headache now might be the reason for the person's death. So you don't lie to your pastor, your doctor. Be open, be vulnerable. Let them know. I've been taking this thing for so many years. Now I'm dependent on it. In fact, I've been abusing it. I've been taking it anyhow. Please help me. What should I do? Please follow up. Diet. Follow it. You have withdrawal symptoms, so it will not help you. Okay, let's assume you're addicted to painkiller. Let me use Tramadol for example. Maybe you're taking 200 milligram of it. You might actually reduce it to like 100 milligram over a period of time. Then from after that period of time, when you notice that you are not having the withdrawal symptoms again, you now reduce to like 50 milligram of smoking. Was by using coffee. Instead of smoking, you will not take coffee because coffee has caffeine also, so it will still stimulate you just like what they get from nicotine in cigarettes. So that instead of smoking, maybe he said before, it maybe takes like 5 sticks, it will reduce it like 2. Then anytime you see that smoke, he will take a cup of tea. He did that for a period of time until he stopped smoking completely. So very, very important presentation here, but I'm going to give, I think we have a question. Okay, before the question comes, I will just tell you a bit about how you can reach out to me. I'm on Facebook, Olasimbo Anjorin. That's my name on Facebook, Olasimbo Anjorin, Anjorin. And on Instagram is Olasimbo.Anjorin. Through WhatsApp, again, 0054781415. Yeah, you already know. I'm a pharmacist. You can call me for consultation, and I do public speaking too. Maybe you need somebody to talk on health in your institution, maybe your church or your workplace. Okay, the question says, can someone's body get addicted to drugs that are used according to prescription? According to prescription, no. Except if you go above the prescribed doses. Okay, this is what I mean by if you go to above the prescribed doses. If your doctor prescribe, you should use it for 3 days. Use it for 3 days. Don't use it for 5 days. If your doctor asks you to use 2 tablets, use 2 tablets. Don't use 4. Don't say 4 tablets of paracetamol. And this is have effects. The only problem that can happen, understand that. So the worst they can do. Let me not say after maybe like 3 days they ask you to take care. You're not seeing effect. For example, let me take anti-malaria. They give you an anti-malaria and you use it for 3 days and you're not seeing any effect. Don't continue the artemether manufacturing that we have. We have in medicine. We have first line, we have second line, we have third line, and that prescribed drugs can cause addiction. What I'm saying is that if you don't follow the prescription, it can cause addiction. So I hope we are clear on that. So that's about time, and I'll be wrapping up here. It's been a good time here passing information, and if you have any, you can go there. You can watch and ask questions. You can send questions on the comment section. We always answer you. You can even, they're even on Instagram, LAGOONRADIO.NG, and on Facebook, Lagoon Radio Nigeria, or Anjorin, Olasimbo Anjorin, and on Instagram, Olasimbo.Anjorin. My WhatsApp number again, 00547814. Deliver to you. Thank you very much. It's been a nice time. Thank you. Good night.
This is Lagoon Radio.
Are you looking for top-notch printing services that deliver quality and reliability every time? Look no further. The Lagos Diocesan Printing Press is here to serve you. At the Lagos Diocesan Printing Press, we specialize in bringing your ideas to life with precision and excellence. Whether you need business cards, brochures, flyers, or banners, we've got you covered. Our state-of-the-art printing technology ensures vibrant colors, clear text, and professional finishing that will make your brand stand out from the crowd. But that's not all. We pride ourselves on exceptional customer service, fast turnaround times, and competitive pricing to fit any budget. So why wait? Visit the Lagos Diocesan Printing Press today at 17 Broad Street, Lagos Anglican, or 0816 3.
Hello everyone. You are listening to Lagoon Radio, Diocese of Lagos Anglican Communion. God bless you as you keep on listening to us. God bless Nigeria. God will keep Nigeria in your domain. In Jesus' name.
This is Lagoon Radio.